Can you just take us through why the beach has been closed and how long it's likely to last?
Well, good afternoon. This measure came in place today after thousands of people flocked to Bondi Beach yesterday. Now, if you've seen the pictures that have been beamed across the world and picked up by international news agencies, you'll know that the weather was fantastic. That coupled with the fact that many people are also working from home, people took advantage of this. Now, there were new social distancing rules put into place yesterday where people have to keep at least 1 metre to 1.5 metres away from each other. There's also bans of gatherings of more than 500 people. Today, there were significantly less people at the beach than yesterday, but there were still definitely more than 500 people. So as a result, this measure has been put into place. It is a temporary measure. We don't know how long it will last. It could be in place for weeks. It could be in place for months. We don't know. New South Wales Police Minister David Elliott said he didn't want to be the fun police, but if people do not comply with these measures and heed the warning of health authorities, then this may become the new norm.
It's with a significant level of disappointment that we have to move today to not only remove people from Bondi Beach, but use this as an opportunity to remind everybody that the Health Act must be complied with. What we saw this morning here in Bondi Beach was the most irresponsible behaviour of individuals that we've seen so far.
So, Victoria, what's the feeling at Bondi now?
Well, there's mixed feelings at Bondi Beach today. Many people were confused by this new social distancing rules put in place. People didn't even know what they were. You saw many people trying to keep their distance, but if you look out into the water, people were wading into the beach with their friends as if it was any normal Saturday morning. Some people say that they are quite concerned about coronavirus and they're taking today as their last chance to actually enjoy the sun and enjoy the beach.
I think yesterday was a bit strange. There was definitely a lot of people here that I didn't expect to be here. But I think the important thing from today is that we all still want to get outside. I think we're in an environment where we like to get outdoors. We've still got beautiful weather. I think as a community, everyone needs something to feel good about.
I'm not too fussed about it, to be honest. I'm not sitting on top of people right now, so I don't know. I think people still come down to Bondi, especially if they live close by, unless there's someone here telling them to keep moving on.
If you look at a lot of restaurants and bars in Bondi, I don't think the rules have been enforced in terms of the square metre per person. So people aren't taking it seriously, but obviously as time goes on, I think it'll become a lot more serious in terms of people's actions and behaviour.
Oh, no. I think everybody's taking it very seriously. But you know, when you've got a weekend, you're still allowed to have some time at the beach. Don't touch people. Don't get too close, other than your family. I think it's okay, but I think everybody's still very, very cautious and very conscious of it.
So, Victoria, we know that New South Wales has beautiful beaches right up and down its coastline, perhaps not as iconic as Bondi where you are, but does this just apply to Bondi or other beaches affected?
It does actually apply to other beaches across New South Wales. Now, this will be a case-by-case basis. So if more than 500 people do gather on beaches across the state and are not heeding that advice from local health authorities, then other beaches may also face closures as well. Now, that assessment will be made with the local council, New South Wales Police, and it will again be on a case-by-case basis. But unfortunately, as New South Wales Police Minister David Elliott said earlier, this is a new norm that we are currently facing with coronavirus.
Victoria Pengilly coming to us from Bondi Beach in Sydney. Thank you. Well, pictures of the crowded attraction amid the coronavirus pandemic have caused a stir on social media, prompting calls for young people to take the control recommendations seriously. Host of RN Health Report, Dr Norman Swan, says it's not just young people dismissing the advice.
So I think young people think that they're steel-belted against this. That tends to be the tendency of young people. They think that they're immune to harm from anything. And the fact of the matter is that about 38% of intensive care, when it's really going, 38% or thereabouts of intensive care beds are taken up with people that are younger. So this is not a problem just of people who are older with multiple diseases. These are younger people, and some of these younger people are dying, and there is no way of predicting who dies and who lives. There's no risk factors. They haven't got heart disease, diabetes or anything like that. They're healthy younger people, and they're going into intensive care requiring major treatment, and some of them are dying. So you're not immune to serious complications. It's just less likely than the older person, but when you've got large numbers coming through, intensive care unit beds tend to get used up with younger people. So it could be you. That's the first thing. So the Secretary General of the WHO was absolutely right. Second thing is that in most countries where they've measured this, 30% of new infections come from younger people. And they come from younger people not because they're going around deliberately doing this, but they've got mild symptoms, they don't recognise they've got COVID-19, and they are probably actually their contagiousness is probably half that of somebody who's severely ill. But because there's so many, they still pass it on. And so it is a major source in the community. Now, there's not a lot of evidence of that yet in Australia, but that will happen as the epidemic grows here. And the thing that young people need to know about is that they're fine. So we go and have a COVID-19 party, we infect each other and we become immune, but you are going to pass it on to your parents, your grandparents who might die, to babies in the first year of life who might get seriously ill, or indeed, and this is what it's all about here, it's our hospitals and our healthcare staff, is that they are at the front line. And it's like the Somme in World War I. Not yet in Australia, but in Italy, absolutely. In Britain, it's getting like that. And in New York, it's getting like that too. And you are going to kill doctors and nurses. So people that you've gone to school with, who've done medicine or nursing or physiotherapy, they are going to be in intensive care, and some of them will die too. And because they're a high risk, 20% of healthcare staff get infected. So if we want the healthcare system to be there to look after us, whether we've got coronavirus or whether we've had a car accident or whether they've got cancer, we've got to protect them too. And a lot of this is about preserving our healthcare system in order that it can do its job, not just in this episode, but for total healthcare of the community.